Hi everyone, happy Thanksgiving to everyone. And today I'm going to talk about a very interesting topic that is herpes. Herpes infection is very, very important. There are two types, that is HSV1 and HSV2. HSV1 is like causing the labialis, mucosal lesions, and sometimes it goes on to the brain, producing encephalitis. So we are not delving deeper into that part. However, we want to focus on HSV virus, where pregnant lady walks in with active lesions. Uh, so, if there are any active lesions at the time of 36 weeks gestation, we may want to do C-section because this is likely to be transmitted to the baby. And so we want to avoid vertical transmission. So, if there are active lesions at the time of labor, do C-section. If the person has a history of HSV, make sure the HSV is under control with antiviral medications, and advocate suppression would then be important. Um, so, if there is complete suppression of the active lesions, there is always a chance to simply proceed like a normal delivery, um, vaginal delivery. So, what is herpes? Herpes, there are two types, right? So, one is herpes zoster, and other is varicella. So, what is varicella? Let's look at varicella. These terms are interchangeable. So, I'm going to break down the confusion. In the varicella, it's because of the chicken pox. Kids may develop chicken pox, and over time, they may have something like reactivation. And this is what we call as the zoster virus infection. And this is called as the herpetic um, infection in the elderly. So that's why it's always important to vaccinate. Vaccination is starting from age 15 onwards. Okay. The main reason is our immune system is slowly getting degraded as we age. So anyone who is older, meaning over 50, we always have to encourage to get vaccinated against this um, virus. Now, the questions may come up from so many different sources. Is it good to have the vaccine if they are infected or if they have had the infection? Of course, it is good. However, the wait period is recommended. How long and what would be the good time to get vaccinated? Any answers? Okay, let me break it down. You need to have the patient's rash crusted over, meaning when there is no infection or the infection is resolving with the adequate crust formation over the rash. That is a good time to go ahead with the vaccine. All right. So in the U world, we have different varieties of herpes infections. One being acute herpetic neuralgias, and then other being subacute, and lastly chronic. You need to know the duration of one we call as acute or subacute. Okay. So this is within less than 1 month of rash onset. This is between 1 to 4 months of rash onset. Whereas this one is 4 months following the rash onset. There is severe pain. This needs to be treated. This is what we call as a post herpetic neuralgias. So the pain here is nasty, massive pain. It is just like a very bad pain. So this needs to be treated with gabapentin being the first choice because we want to calm down, okay? Calm down the nerve. So let's move on to the remaining two are also painful. You may want to put the patient on NSAIDs along with antiviral drugs. Okay. Now, slowly, let's move on to the pathophysiology. This is also a very great question that UWorld explains, and it explains like butter, meaning it's so smooth and nice. There is a whole new video on UWorld. You will definitely find it useful. However, to supplement and enhance our understanding, I would like to add in the pathophysiology. So initially, whenever there is a chickenpox infection, the infection resides in our sensory ganglia. Okay, the virus is proactive in this case. Even after the patient has complete resolution of chickenpox, the virus can get activated. Now, what are the reasons for it being activated? Is first big reason is age. Next is the stress. Next would be immunosuppression. Any patient on chemotherapy, surgery, or chronically admitted in the hospital. So this can move on to through the anterograde transport, that is dyne arms, and um, through the nerve cells, it can get propagated all the way to the skin. Okay. So in the skin, it appears in the form of vesicles, pustules, scabs, pus, discharge, then papules as well. So since this is activated by the sensory ganglion, it causes what we call as outbreak of crops of vesicles. And these vesicles follow a single dermatome. This is a classic way of diagnosing. It is utmost importance. At this point, a person has to get treated because the nerve distribution is very, very classic over here. What else? If we do not treat it, person can go into a chronic state, that is post-herpetic neuralgia. So this is very, very important. I hope it is of use to any medical student out there watching this. If you're not getting to watch this, please make sure to share it with your friends as well, because sharing is caring.